Good afternoon and welcome to our midweek COVID update. In fact, this is the Bar Mitzvah edition. This is our 13th time, and I've put on this tie especially for the occasion. But also, we really are in a good space at the moment, and I'll just show you now. So we are maintaining our low level of cases on the epidemic curve. This is still pretty low. And in fact, it's interesting when we look at the curve, the first, second, and third waves, we are now at the lowest level of 7-day moving average of daily cases, really since the epidemic began. So we really are in a very good space. The level of activity at the moment is actually very, very low, the lowest it's been since the pandemic started. This is really kind of corroborated by, if we look at the percentage of tests which are positive. I think I've mentioned that is a very accurate parameter to look at the level of activity. And the 1.4%, let me get my laser pointer up. This 1.4% over here is also the lowest since the pandemic began. It's actually interesting, and look at globally, also the pandemic does seem to be coming down globally. A little bit of kink up there. Obviously not in all countries around the world. Some countries are battling, particularly in Eastern Europe at the moment. But globally, it does seem to be coming down. But certainly in South Africa, we are good. We look at the dashboard, 331 cases reported over the last 24 hours. That's fairly lowish. 53 deaths reported over the last 24 hours. And the HATZOLAH data also pretty low. Only one new case over the last week ending in the last week, over the last preceding week, and 22 active cases on the home monitoring program. So all in all, looking pretty good. I've had quite a number of queries, and I just want to actually just amplify what is actually going on with people, particularly for the Medical Research Council. They talk about excess deaths. And a lot of people have asked me what is meant by excess deaths, and also why are people like the Medical Research Council and various modeling groups kind of feel that this 88.987, the reported mortality from COVID, is quite a markedly underreporting. In fact, they feel that the actual mortality is about 3 times this figure. Now, I just want to go through just to explain where this comes from. So if we look at our usual curve, the 7-day moving average of daily cases, the one we're very familiar with, and we look at the recorded deaths, that's all deaths, and we see that it really kind of follows the pattern of each of these waves. It kind of fits in very, very well. And the recorded deaths is significantly higher. This is what we call excess deaths, excess above what we would predict the basic predicted baseline of deaths are. This is what we would think the death rate should be, and what it has been over many years going backwards. And this is the amount of deaths which is in excess over the predicted deaths. And it's interesting when we look at the COVID recorded deaths, this excess deaths is far in excess. So we're using the word excess quite a lot here, far in excess over the COVID deaths. And this excess over here, this amount over and above the COVID deaths, is what the Medical Research Council, the modelers feel is our underreporting. That the number of deaths is probably about 3 times, looking at about 260,000 deaths rather than the 88,000 deaths which has been reported. Just to explain that, a number of people have asked me about it. All right, let me now just talk about the vaccines. Where are we now? The total number of doses which have been missed. This is a rather busy slide, but I just want to kind of just point to a couple of things to show you some interesting data. Just under 28 million doses of vaccine have been administered, broken down to the 5 million of the Johnson & Johnson. The Sasonki study, if you recall, was the study in the healthcare workers early in the year. Just under 500,000 doses were administered then. That's the first dose. Hopefully soon they'll be getting the booster of Johnson & Johnson vaccine. And 4.6 million additional Johnson & Johnson vaccine were administered to other groups such as the teachers, security personnel, and other individuals as part of the rollout. So quite considerably more Pfizer doses have been administered, 60.6 million. And if we look at the adolescent rollout, the 12 to 17-year-old, this is a bit disappointing. Only 74,000 doses have to date been administered to the teenagers, 12 to 17 years of age. So this really needs to pick up quite considerably. Also, our daily vaccine administration is also still disappointingly low. As I mentioned on previous occasions, we need to get to about 250,000 doses, 250,000 doses per day, per working day, if we want to really get to our target of 70% of the adult population by the end of the year. And clearly, we're not going to get there. This will overflow into next year. But we really do need to pick up our routine vaccine rollout. Just a little bit on the low side at the moment. Looking at the percentage of adults who've been vaccinated so far, the Western Cape still leading the pack with 46% of adults being vaccinated. There are 4 provinces which are doing well: the Western Cape, Eastern Cape, Free State, and Limpopo. And 5 provinces not doing quite so well. Gauteng amongst them, we're still lagging behind. The high-risk group, the 60-plus age group, the ones that we're really focusing on the vaccination rollout more than the teenagers. So we really need to kind of fill this gap. At the moment, only 62.4% of the high-risk group, the group that are more likely to get severe disease and more likely to be hospitalized, only 62.4% have so far been vaccinated, either fully or partially. And 50 to 59-year age group, 55%. Have been vaccinated. If we go to those which the percentage being fully vaccinated, it's a little bit lower. In the 60-plus year age group, 55% have been fully vaccinated. That's with 2 doses of Pfizer or the 1 dose of Johnson & Johnson. And 50 to 59 years, just under half have been fully vaccinated. So we've still got a ways to go. We've still got to get there. Summarizing it all, as I said, 21.7 million doses have been administered. Fully vaccinated, just under 12 million individuals have been fully vaccinated. That's just under 30% of the adult population and just under 1 in 5 of the total population if we include children. Total individuals vaccinated, 36%. That's 14.3 million doses. And just under a quarter of the total population have been vaccinated either fully or partly. So there still is quite a gap. We still need to kind of get there. But, you know, it's interesting that a lot of people are now feeling, in a way, fairly euphoric having been vaccinated, that all that's calling for restrictions to be lifted. I think it's a political football as well, saying that that the restrictions might be lifted. I just want to put a couple of slides now to show you a bit of a cautionary note that we mustn't prematurely, too soon, lift our restrictions despite vaccination. You know, if we look at countries like the United Kingdom, the first country in the world to start the vaccination program, and getting a pretty high vaccination coverage, 71.3% as against our 36%. So we're not even halfway, in fact, fully vaccinated, not halfway to get anything out of the kingdom. Now, in June, July, when they kind of reached this kind of figure, they decided, well, let's kind of lift most of our restrictions. Let's try and go back as much as possible to a pre-COVID lifestyle. And this is what happened. There was a sharp kick up of cases, as you can see over here. And they, in fact, are still at a pretty high level of cases. And I'll show you just now, comparing it to South Africa. And also an increase in deaths corresponding to the increase of cases. Israel, which is a leading country in the world in terms of vaccine coverage, just under 88% coverage. And again, they decided to lift most restrictions and had an enormous uptick of cases. In fact, reaching a level higher than ever in their pandemic. Fortunately, now it is coming down quite markedly, but they had quite a significant increase of deaths corresponding to this increase of cases. So again, prematurely lifting those restrictions does come with a cost. I'll give you another example of another European country, 77% vaccine coverage, and also lifting restrictions and an upward increase of cases and mortality. So if we look at a summary and aggregate of all of this, and I've aggregated the 7-day moving average currently up to the present date, and adjusting it to the population, per million population of cases and per million population of deaths. So South Africa currently, and of course we're at a very low level, so it might not be quite fair to compare, but nevertheless, we are 6.8 cases per million population, 0.7 deaths per million population. You compare it to currently in the United Kingdom, there are nearly 10 times the number of cases adjusted per million population, 638.7 cases per million population, and 1.97 deaths, more than twice the deaths adjusted per population as South Africa. Israel, also 9 times the case per million that we are, but death somewhat less than we are, and Spain's figures as well. So again, I think a salutary lesson that we, even with vaccination, we do at current, that virus is still circulating and is still going to kind of catch those unvaccinated individuals and those individuals that have been vaccinated but not quite successfully vaccinated. And if we remove those non-pharmaceutical interventions, the other infection prevention drive to kind of suppress the virus, we will have an uptick despite vaccination. Well, let me go on to the questions. And I've had a number of questions, particularly related now to the teenage vaccination program. It's been quite a concern amongst parents about some of the side effects. And let me kind of stress that the side effects are, in the vast majority of cases, mild, self-limiting without any problems. The tenderness in the arm, a bit of fever, and that'll go away. The more severe side effects are extremely rare. The one which has got a lot of publicity is myocarditis. And I've had a number of questions. What is the risk of myocarditis, particularly in the teenage population? So the best data comes from Israel, and I've summarized it. It's a busy slide, but let me take you through it. After the first dose, you can see that the complications, in fact, very, very rare, very rare. And in fact, in the older age group, the aggregate of the entire adult population over 30, you can see it's pretty rare, 10 per 2 million doses after the first dose. Most of the myocarditis, when I say most, of a rare complication, occurs after the second dose of the Pfizer. By the way, this is limited to Pfizer. This hasn't been reported with the Johnson & Johnson vaccine. And here you can see that certainly it's much more common in males as compared to females. So this really is a complication seen particularly in adolescents and in young adults. And after the third dose, which doesn't really apply to South Africa, but in Israel, it's very much less common. So to aggregate the risk of myocarditis after vaccination, it is about 24 per million following the second dose. Following the first dose, it's probably about 2 or 3 per million following the first dose. So it is it's a rare complication. Compared to COVID itself, now COVID infection, that is about 16, myocarditis is about 16 times more common than the vaccine risk. Now let me just talk a little bit, what do we mean by myocarditis? Myocarditis, as the name implies, is an inflammation of the heart muscle. It's usually an autoimmune phenomenon. In other words, that the immune system of the individual that has been vaccinated, triggered by the vaccine, seems to react against the heart muscle, causing this inflammation. Sometimes it's also accompanied by inflammation of the lining of the heart, the pericardium, and we call it then a myopericarditis. The symptoms are usually chest pain. There may be a fluttering sensation, maybe acute shortness of breath, and it's usually diagnosed on ECG and on clinical examination. But the important thing, what I do want to emphasize, the myocarditis in virtually all cases where it has been reported as a complication of the vaccine is mild, self-limiting. Most cases don't even come into a hospital. They can be looked after at home, and they will recover usually after a few days without any complications at all. So this is in the vast majority of cases of a very rare complication following vaccination. And as I said before, the risk in COVID of disease itself is far more common and usually more serious than that following vaccination. The other rare complication, and I must mention, the other rare severe complication is the allergic response. And this is about 4 to 5 cases per million doses of vaccine, 4 to 5 per million. And that's the severe allergic reaction, what we call anaphylaxis. And it's due to an allergic reaction against one of the constituents of the vaccine. We call it polyethylene glycol. And individuals that are allergic to polyethylene glycol are very, very rare. So I say 4 to 5 per million. And there have been no reported cases. Virtually everybody has survived, but it is, of course, a severe complication. Other allergies seem to be unrelated. People that adolescents are confined into that group who may be allergic to egg protein or certain foods or fish and so on and so forth, or pollen, hay fever, that's completely unrelated to the allergy to polyethylene glycol. This is a rare, unpredicted complication. And those are really the only severe complications following the Pfizer vaccination. So just to reassure, these complications following vaccination are extremely rare. They are, in the vast majority of cases, can be well treated or self-limited. So the vaccine is very, very safe and it's effective. And I can just only recommend parents to encourage and to take along their teenage children to be vaccinated. So that's all for today, and look after yourself, and look forward to seeing you next week. So all the very best. Thank you.